PG Doctors NEET. It's your YouTube channel.
Hi doctor friends, welcome to my YouTube channel PG Doctors NEET. Today's topic is epithelial cell, which are very important for you due to one question is always asking in the medical PG exam. So let us start. The epithelial cell. Okay, the first of all, what is the definition of the epithelial cell? It is the covering of body surfaces, lines body cavity, and it constitutes the glands, and it is avascular in nature. Avascular in nature, and composed of cells that cover the exterior surface and line internal closed cavity. That means if it is the outer surface area, then it becomes a cavity like a structure. The outer is avascular. Okay, this is avascular, while that of the inner layer is vascular, and the nutrient supply to the outer layer by the osmotic process. Okay, it forms the secretory portion of glands and their ducts, and a specialized epithelial cell function as a receptor for the spatial senses. Okay, if you talk about the spatial situation, that means when the free surface are lack of free surfaces, in that condition is found in the Leydig cell, like Langerhans cells, and like adrenal glands, and tumor derived epithelial. And if you talk about the function of epithelial cell, includes secretion, absorption, transportation, protection, and receptor. Okay, if secretion like a gastric gland, okay, in the stomach. Absorption, that means PCT in the kidney. Transportation like motile cilia along the surface and in the GIT system, like in the small intestine, duodenum, ileum, jejunum. Protection from the exterior in the skin, which protect our body from the acting organism, bacteria, virus, fungus, like that. And in the urinary bladder, urothelium. And if we talk about the receptor like olfaction, that means smell, and another thing is taste sensation. Types of the epithelium. If it is before describing the type, if the layer is single layer of the epithelial cell are found, that is called simple, while that if it is more than one layer, this is called stratified. Okay, and mainly divided into squamous, columnar, cuboidal, and transitional. Mainly 4 types of epithelial cells are found, which are divided into, like squamous epithelium, into 2 types: simple and stratified. Columnar is also divided into simple, it may be of the stratified, it may be pseudo stratified, okay, and ciliated. After that, cuboidal. Cuboidal is also of simple and stratified, and transitional epithelium is also called as urothelium. Okay, first of all, talking about the squamous epithelium. Squamous epithelium, I'm not going to detail about the structure. First of all, where it is found, that is maximum question asked from that. The type of epithelium found in such organ, and like alveoli, like upper nasal cavity, etc. So simple is found in like alveoli of the lung, blood vessels, that means endothelium. Another is the Bowman's capsule of the kidney, and some thin segment of loop of Henle. This is endothelium. And another place is serosa, endothelium and serosa. Serosa, that means pericardium and peritoneum. Many times asked the question about the peritoneum and the pericardium. So again revise it. Simple squamous epithelium is found in the alveoli, blood vessels, where endothelium, serosa, where pericardium, peritoneum. Another place is the Bowman's capsule, and the thin segment of loop of Henle. This is the brief review about the squamous and simple squamous. Stratified is found in stratified. Again, it is of two types. What? It is of keratinized and non-keratinized. Then where is keratinized? Keratinized squamous epithelium. Keratinized stratified squamous epithelium. This is found in the skin and anus where below the Hilton's white line. Okay. Another place is the duct of sebaceous gland. This is the keratinized stratified squamous epithelium found in the skin, anus is below the Hilton's white line, and duct of the sebaceous gland. If we talk about also the nail, if we talk about non-keratinized stratified squamous epithelium, this is found in the anal canal, vagina, larynx, and oral cavity, esophagus. How to remember? First of all, the keratinized, that means keratin layer found in the outer surface of the epithelium. The skin, anus, and duct of the sebaceous gland, you have to remember this, and you will know about the skin. Non-keratinized stratified squamous epithelium, the anal canal, canal, vagina. This have to remember that it is the non-keratinized stratified squamous epithelium. While that of, if we make the diagram, this is the tongue, and it is lower part, and this is the larynx. This oral cavity, trick to remember, oral cavity, then no pharynx, is not pharynx is not lined by the stratified squamous epithelium. You have to remember oral cavity, after that larynx, then after esophagus. This lining is of non-keratinized stratified squamous epithelium. Okay, larynx, oral cavity and esophagus. Okay, this is trick to remember. Then columnar epithelium. Columnar epithelium, simple type. Trick to remember that the columnar epithelium is mainly responsible for the absorption. Okay, so this is found from the stomach to large intestine. So the mucous membrane, mucosa of the stomach to and large intestine, and between them is the small intestine, and a small intestine is mainly responsible for the absorption of electrolyte, water, protein, carbohydrate, simplest form of the carbohydrate like glucose, etc. So the small intestine is lined by the villi. Okay, so this is very important simple type of the columnar epithelium. If we talk about the stratified epithelium, stratified columnar epithelium found in the membranous urethra. Okay, membranous urethra is found where, if we make the diagram, this is the urinary bladder and here prostate, so this is called prostatic urethra. After that, a line membranous part is known as membranous urethra. After that, this is called a spongy urethra. Okay, mnemonics to remember. The pseudo stratified. Okay, the pseudo stratified, to remember, this is found from, if we make a diagram, the trick to remember pseudo stratified ciliated epithelium, columnar epithelium. Then remember, this is the nasal cavity. This is nasal cavity. This nasal cavity, whole part of the nasal cavity. Then it becomes the pharyngeal area, pharynx. This also by pseudo stratified. After that, some part is there left, laryngeal part. Okay, this is larynx part, and this larynx part is by non-keratinized, while that of all respiratory tract, this is respiratory tract, and this is trachea, bronchi and bronchioles, all the respiratory tract till the alveoli is lined by pseudo stratified. Okay, and another trick to remember, that at the point of the nasopharynx, where the auditory tube, okay, or Eustachian tube tube or eustachian tube are opened here from the ear. These are also lined by the pseudo stratified columnar epithelium. Okay, and also you have to remember the urethra, the uterus, fallopian tube, endocervix, ventricles of the brain are lined by ciliated columnar epithelium. Okay, and urethra and also the epididymis. Epididymis. Then simple cuboidal epithelium is found in the alveoli, ovary, terminal bronchioles and germinal epithelium. In the alveoli there is also cuboidal epithelium and simple squamous epithelium. Ovary, then terminal bronchioles, after that germinal epithelium. Something is escaped, that the columnar ciliated. Columnar ciliated, to remember, first you make a diagram of this is fallopian tube and uterus. This is fundus part, this is body part, and inner part of the cervix is called endocervix. These all are lined with columnar ciliated epithelium and also in the ventricles of the brain due to CSF formed from the lateral ventricle goes to third ventricle, then to fourth ventricle, and from fourth ventricle itself to the brain and fourth ventricle to the spinal cord. So here ventricles of brain is lined by columnar ciliated epithelium. Then stratified, already talk about the cuboidal epithelium, simple type and stratified type. Stratified type found in the Bartholian gland and exocrine gland like salivary gland, pancreas, sweat gland. And question is asking about some confusing question. Where is the Bartholian gland? Bartholian gland found in the vagina, where to the labia minora. Okay, and another question is asking that the Bartholian gland and Brunner's gland. This is confusing due to Brunner's gland and Bartholian gland. Brunner's gland found in the duodenum. So don't be confused. Some interesting thing. about the simple cuboidal. This is also found in the kidney. This is nephron, the structure of the nephron in the general structure. This is the afferent arteriole, afferent, and this is the efferent arterioles, and this is the Bowman's capsule. So this is the arteriolar structure, and endothelium of the arterioles are the lined by the simple squamous epithelium. So Bowman's capsule are also lined by the simple squamous epithelium, while that of start from the PCT, proximal convoluted tubule, to descending, ascending, then to the collecting duct. Okay, this is till distal convoluted tubule. These are lined by the simple cuboidal epithelium with brush border. So all are lined by the cuboidal epithelium. First of all, remember such thing. PCT are lined by mainly cuboidal. This is also by the cuboidal, but in some it is also flat squamous. Okay, this is flat squamous epithelium also. And the ascending, in the ascending limb, thick limb, loop of Henle, this is low cuboidal, but here microvilli are absent. Here microvilli are present, but in the ascending, thick ascending loop of Henle, there is cuboidal, low cuboidal, while that of this part, ascending part, this ascending part is also of the cuboidal in the nature. And DCT, few microvilli are present, that means brush border. So this is with brush border, but it is deficient, and here the brush border is present in the less quantity. The DCT, distal convoluted tubule, with the cuboidal, while that of the collecting duct, the collecting duct is lined by the simple columnar or cuboidal. Cuboidal or columnar epithelium. This is trick to remember. And if you talk about the transitional epithelium, transitional epithelium are also known as the urothelium. Then urothelium, that means it is situated here where the urinary passes start. That means the start from the minor calyx to the prostatic urethra. Okay, from minor calyx to the prostatic urethra. So you can easily remember that in the arterioles. This is lined by the simple squamous epithelium. Bowman's is also lined by the simple squamous epithelium. After that, cuboidal in the nature. Some part is also flat squamous epithelium and cuboidal in mainly cuboidal in the nature. Cuboidal, 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 cuboidal and columnar also. After that, this collecting duct collected to the minor calyx to the major calyx, and start from minor calyx, it is start becomes transitional in the nature, and this goes to prostatic urethra. And after that, after prostatic urethra, it is lined by, that means membranous urethra to the spongy urethra. This is after that it's lined by the stratified columnar. Again, for the revision purpose, this is only based on the question is asking where that type of the epithelium found. So I'm not discussing about the structure, but mainly where it found. So again, for the revision, that the squamous is simple, stratified. Simple is found in the alveoli, blood vessels, endothelium, serosa, where pericardium, peritoneum, and Bowman's capsule thin segment of the loop of Henle. And stratified is of two types: keratinized, non-keratinized. Keratinized is found in the skin duct of sebaceous gland, anus below the Hilton white line. Non-keratinized is found in the larynx, vagina, anal canal, and the oral cavity and esophagus. Okay, till esophagus. Here oral cavity, then after to becomes to the larynx to the esophagus. After that, esophagus to stomach to the small intestine, then after it becomes ascending colon. I'm not good in the diagram, so sorry for that. And this from here to there is lined by the columnar epithelium. Okay, above that pseudostratified, below that the columnar epithelium found. Okay, at the anal part, anus, this is again non-keratinized. Okay, after that the columnar epithelium, simple, already told, stratified to the membranous urethra, and pseudostratified, already told that pseudostratified found in the where nasal cavity to pharynx, auditory tube. This larynx part is escaped. Then after to the bronchioles, trachea, bronchioles, and terminal bronchioles. The terminal bronchioles is lined by the simple cuboidal. Okay. After that, this is by simple squamous epithelium. Columnar ciliated. This is found in the fallopian tube, uterus and endocervix. After that, the ventricles. Okay. Then we talk about the cuboidal. Then cuboidal is the simple stratified, simple in the alveoli, ovary, terminal bronchioles and the germinal epithelium, and the part of the PCT, the nephron is by the cuboidal and stratified by the in the Bartholin gland and exocrine gland. Okay. And the terminal bronchioles, transitional epithelium, also known as the urothelium, is minor calyx to the prostatic urethra till prostatic urethra. So this is to mnemonics. This is the mnemonics to remember the epithelial lining. So thanks for watching my video. Have a nice day. Again, any query regarding this video and suggestion, please write in my comments box.